Have you ever felt that strange pain in your leg and thought, it must be fatigue? What if it wasn't? Every 37 seconds, someone dies from a clot that no one saw coming, silent, without warning, while life went on as normal. This fear of suddenly losing your health with no chance to react is real, and you deserve to know what's happening inside your veins right now. In this video, I'm going to show you signs your body is already sending and what to do before it's too late. I am Dr. Kevin Vries. The silent enemy, clots that kill. Every 37 seconds, a person dies from blood clot complications in the world. This is not an exaggeration, not a statistic from a distant manual. It's a clock that's ticking as you read this now. And what worries me most, after more than 15 years of following patients with this diagnosis, is how much this threat goes unnoticed until it's too late. The clot, or thrombus, acts like a plug that forms inside a vein. Imagine a hose with a piece of hardened clay inside. The blood can't pass through properly, the pressure builds, and if this plug breaks loose and enters the bloodstream, it can travel straight to the lungs or the brain. And when that happens, the consequences are very serious and often irreversible. In Brazil, the numbers are frightening. In a single decade, more than 425,000 hospitalizations for venous thrombosis were recorded. And the detail I need to warn you about. 92% of these hospitalizations were on an emergency basis. That is, the vast majority of people arrived at the hospital already in crisis, with no time for planning, no time for choices. The body simply collapsed. I saw it happen. A 67-year-old man who walked every day woke up with a dull pain in his leg. He thought it was a cramp, ignored it for 3 days. When he arrived at the emergency room, the clot had already dislodged. He was hospitalized for 11 days and lost part of his respiratory function forever. What makes this enemy so dangerous is precisely its silence. Venous thrombosis, most of the time, doesn't scream. It whispers or says nothing at all. It can appear as mild swelling, a fatigue you attribute to age, a little pain that seems muscular. And while you wait for it to pass, it advances. This is the central point that needs to be clear. The absence of symptoms does not mean the absence of risk. How thrombosis forms in your veins. Imagine your veins are like an escalator running in reverse. The blood needs to move up from your feet to your heart, fighting against gravity the whole time. To do this, the veins in your legs have small internal valves, like little doors that open and close in sync to push the blood in the right direction. As long as these valves work well, the flow continues. But when they start to fail, the problem begins silently. And that's exactly what happens with aging. Over more than 15 years of treating patients, I frequently see cases where these valves weaken gradually, without pain, without warning, without any clear sign at the beginning. Blood starts to pool in the leg veins like stagnant water in a clogged pipe. And when blood loses speed, it clots. It forms a thrombus, a clot that settles there quietly while the person continues life as normal. What comes next is what worries me most in clinical practice. This clot can break loose, and when it breaks loose, it doesn't stay put. It travels through the bloodstream up to the lungs and blocks the passage of oxygen. This is a pulmonary embolism, one of the leading causes of preventable death worldwide. A death that often happens hours after the person was walking, talking, living. A sedentary lifestyle and excess weight accelerate this process brutally. Have you been sitting for hours on end? The flow drops. The blood slows down. The risk goes up. I treated a 67-year-old woman, an active homemaker, who spent 2 days almost without leaving the sofa after a simple flu. When she came to the office, she had already formed a clot in her calf. She felt almost nothing, just a slight swelling that she thought was from fatigue. This is the real danger of thrombosis. It doesn't give a clear warning. It acts from the inside, while you wait for something obvious to appear. The 6 distress signals your legs are sending. The human body is extraordinarily honest. It warns before it screams. And the legs especially carry signs that most people learn to ignore over time, treating them as something normal, as an inevitable part of aging. I need to tell you that it's not. Over more than 15 years of following patients with circulatory problems, I see the same pattern repeating itself. The person comes to the office when the problem has already advanced too far, because for months, sometimes for years, they normalized what their body was screaming in silence. Heavy legs at the end of the day are not just a sign of fatigue. Swelling in the feet and ankles that disappears in the morning and returns at night is the venous system crying for help. Cramps that wake you up in the middle of the night are muscle spasms caused by compromised circulation, not just a lack of magnesium. Here's a detail that almost no one notices. Changes in the skin of the legs, such as dark spots, skin that's cold to the touch, or a progressive hardening of the tissue, are signs that blood is not getting there and back as it should. The tingling, that persistent buzzing in the feet, indicates that the nerves are suffering from a lack of adequate irrigation. And what about varicose veins? They are not just a cosmetic issue. They are veins that have lost the ability to efficiently push blood back to the heart. Each of these signs, isolated, already deserves attention. Together, they form a clear map that the venous system is on high alert. Vitamin E, the protective shield for your veins. There is a nutrient that the body itself recognizes as an ally of the veins, and that most people never associate with blood health. Vitamin E has this silent but profoundly important role. It's not a fad, it's not indiscriminate supplementation. It's about understanding how this compound acts inside the vessels to prevent blood from becoming a problem at home. Platelets are small cells with a fundamental role: to seal wounds. The problem begins when they start to clump together inside the vessels for no apparent reason, as if trying to plug something that isn't broken. This process, without control, is the starting point for dangerous clots. Vitamin E acts directly here. It functions as a natural anticoagulant, inhibiting this tendency of platelets to clump together improperly. A study published in the journal Thrombosis Research confirmed that it reduces the blood's propensity to clot inside the vessels, creating an internal environment less favorable to the formation of thrombi. It helps the blood to keep flowing, without forming obstacles in the paths where it needs to pass. For those over 50, this is not a secondary detail. With time, the blood naturally becomes thicker, and platelets become more reactive. When vitamin E is at adequate levels in the body, it helps to maintain this balance, functioning as a shield that protects the integrity of your veins day after day. 3. Fronts of action of vitamin E in the body. 3 distinct mechanisms acting at the same time in the same system. This is what impresses me about vitamin E when I look at it from a clinical point of view, after more than 15 years of following patients with vascular history. The first front is the protection of the vein walls. Think about what happens when a metal pipe is exposed to oxidation. It rusts, loses its smoothness, begins to accumulate impurities on the surface. With your veins, the process is similar. Free radicals, which are unstable particles generated by stress, poor diet, and the aging process itself, attack the inner lining of the vessels and create small irregularities. And it is precisely in these irregularities that clots find space to attach. Vitamin E acts by neutralizing these radicals before the damage occurs, keeping the surface of the veins smoother and less receptive to problems. The second front involves the platelets. I see this in my practice frequently. People who have no diagnosed disease, but whose blood already has a silent tendency to clot more easily than it should. Platelets, when they become excessively active, begin to clump together without any real need, as if they are in a permanent state of alert. Vitamin E reduces this stickiness, restoring a more balanced behavior to the platelets. The practical result is blood that circulates more fluidly and with less risk of spontaneous thrombus formation. And here's a detail that almost no one notices. The third front is vasodilation. In addition to protecting and regulating, vitamin E also helps the vessels to relax. More relaxed vessels offer less resistance to the passage of blood, which relieves pressure on the entire system. It's like the difference between walking down a narrow, crowded hallway and a wide avenue. The effort required is not the same. What makes this relevant to your routine is not just the mechanism itself, but the fact that these 3 actions happen in an integrated way, without you needing a separate intervention for each one. The 6 champion foods in vitamin E. Some things seem too simple to be true, but in medicine, what saves lives most often is not the complicated, but the consistent. And when it comes to vitamin E, nature has been generous with its sources, and you don't have to look far. I'll start with sunflower seeds, which carry one of the highest concentrations of vitamin E that exist in a food. A small handful, the kind that fits in the palm of your hand, already contributes significantly to protecting the cell membranes of the arteries. Alongside it, almonds are a perfect match, with good fat and an amount of vitamin E that many pharmaceutical capsules can barely imitate. Extra virgin cold-pressed olive oil, which I always recommend in my clinical practice, is not just tasty. It carries tocopherols, which are the most active forms of vitamin E, and acts directly in reducing the oxidation of fats in the blood. Here's a detail that almost no one notices. The quality of the olive oil matters a lot. Real extra virgin, cold-pressed, is different from the processed oils that use the same name. Spinach, avocado, and fatty fish like salmon, sardines, and tuna complete this group of allies. Avocado combines vitamin E with monounsaturated fats in the same bite, creating a favorable environment for the absorption of nutrients that protect the veins. Fatty fish, in addition to omega-3, deliver vitamin E along with anti-inflammatory compounds that work together. Over more than 15 years of following patients, I realized that those who include at least 3 of these foods in their daily routine rarely need high-risk supplementation. These people practice preventive medicine without knowing it, simply by choosing better what they put on their plate. The allies that multiply the effect of vitamin E. No nutrient acts alone inside the body. This is something I've learned over more than 15 years of clinical practice, and when it comes to vitamin E, this truth becomes very evident. Omega-3, present in fatty fish and flax seeds, reduces the viscosity of the blood. Thick blood circulates with effort, like cold honey trying to pass through a narrow straw. Omega-3 changes this consistency and creates a much more favorable environment for vitamin E to work. But here is a detail that almost no one notices. Vitamin C produces collagen, which keeps the walls of the veins firm and elastic. And after vitamin E acts in the body, it becomes temporarily inactive. It is vitamin C that reactivates it, that returns it to the protection cycle. Without this partner, a good part of vitamin E's work simply goes away. The flavonoids from red fruits, such as blueberries and blackberries, strengthen the capillaries and also reduce local inflammation. I see this in practice very frequently. Patients with heavy legs and swelling who improve visibly when they start to include these fruits regularly in their diet. And there is something even simpler and far too underestimated: water. When hydration is insufficient, the blood becomes more concentrated, thicker, and circulation worsens. The entire action of the other nutrients is compromised if the body does not have enough water to keep the flow working. Sometimes, the most important change starts in the glass you forget to fill. The hidden risk of high-dose vitamin E supplements. Supplementing with vitamin E seems harmless. A colorful bottle, a small capsule, a promise of protection on the back of the package. But there is something that almost no one tells you when you pick up this supplement at the pharmacy. In high doses, vitamin E acts on the blood in a way that can become dangerous, depending on what you already use or what is to come in your health. Let me explain. Vitamin E has a property that, in the right amount, is beneficial. It interferes with the blood's ability to clot. It works as if it slightly loosens the mechanism that makes the blood thicken when necessary. In normal situations, this might even seem advantageous, but when the dose goes up, this effect is amplified, and that's where the problem begins. I see this in my practice with a frequency that worries me. People who arrive taking vitamin E in high-concentration capsules combined with medications like warfarin or aspirin, which already have an anticoagulant effect on their own. This combination can significantly increase the risk of bleeding, sometimes in places you don't expect, like the digestive tract or even the nervous system. And the most insidious thing is that this risk acts in silence, without pain, without a clear warning. What comes next is especially important for anyone with any surgery on the horizon. 2 weeks before a surgical procedure, the vitamin E supplement must be stopped, not because it is a poison, but because the body needs its full clotting ability during and after surgery. Bleeding that does not stop in the right time can complicate an entire recovery. Diet, in these cases, remains the safest path. Natural sources of vitamin E, such as olive oil, nuts, and seeds, deliver the nutrient in doses that the body absorbs in balance, without creating the excess that a concentrated supplement can cause. The biggest enemy of circulation: a sedentary lifestyle. Being still kills slowly, and that is not a clinical exaggeration. Over more than 15 years of following patients with circulatory problems, One of the things that impresses me most is how a sedentary lifestyle can be invisible to those who are in it. The person feels the fatigue in their legs, the swelling at the end of the day, that feeling of heaviness that they attribute to age, when in fact what is happening is much more specific than that. There is a muscle structure in the legs, in the calves, that doctors call the second heart. This is not poetry, it is physiology. Every time you take a step, this muscle contracts and pushes the venous blood back up against gravity towards the heart. When you sit for hours, this pump stops, and the blood literally begins to accumulate. It stands still, it stagnates. It creates the ideal environment for clots, varicose veins, and silent inflammations that take hold without warning. I treated a patient a few years ago, 63 years old, a retired teacher who said she had no serious problems. But she spent most of the day sitting, reading, watching television. She came to the office with a discrete edema in both legs that she thought was normal for her age. It wasn't. It was a direct reflection of a circulation that had lost the muscular support it needed to function well. What comes next might surprise you with its simplicity. 30 minutes of walking a day are enough to reactivate this mechanism. And if 30 minutes in a row seems like too much, 3 10-minute blocks throughout the day produce the same effect. The body doesn't need a marathon. It needs continuous, regular, honest movement, because no vitamin, no supplement, and no technology can replace the simple act of putting one foot in front of the other. Daily habits that protect the veins in the long term. The body warns before it cries for help. The swelling that appears at the end of the day, the feeling of heaviness in the legs, that tiredness that seems greater than it should be after a short walk. These are signs that many people learn to ignore because they seem trivial. But over more than 15 years of clinical practice, I have frequently seen how these small signs precede larger problems when no habits are adjusted. Good venous circulation depends, in large part, on what you do in your daily life, and not just on what you take or avoid eating. One of the most effective pieces of advice I give my patients is simple. Set aside 15 minutes at the end of the day to lie down and elevate your legs above heart level. You don't need equipment, you don't need a gym, just a pillow under your legs while you rest. This gesture promotes the natural drainage of blood that accumulates in the legs over hours of standing or sitting, relieving the pressure that the venous valves endure throughout the day. Here is a detail that almost no one notices. Body weight has a direct impact on these valves. They function like small floodgates inside the veins, preventing blood from flowing down when it should be going up. When the body carries more weight than the veins can compensate for, this constant pressure begins to wear them down. Not dramatically and immediately, but silently over months and years. Another point that deserves attention is the type of clothing you wear. Tight belts, pants that compress the waist or groin, elastics that mark the skin, all of these interfere with return circulation. The blood needs a clear path to go up. Any excessive pressure in these areas acts as an obstacle. And when you are sitting for long periods, whether at home watching television or on a long trip, the simple act of moving your feet and ankles in small circles already activates the calf musculature, which works as an auxiliary pump for the heart. I call this the peripheral pump, and it is underestimated by most people. These minimal movements make a real difference when practiced regularly, because they keep the blood flow active, even during moments of prolonged rest. Taking care of your veins does not require sacrifice. It requires consistency. Now you know that taking care of your veins doesn't require an expensive prescription or complex treatment. It starts today, at lunch. A spoonful of extra virgin olive oil, a handful of almonds, an extra glass of water, and before bed, elevate your legs for 15 minutes. It's that simple. Tell me in the comments, did you already feel any of these signs in your legs and not know what it was? If this content made sense to you, subscribe to the channel, because every week there is information like this to help you live with more health and awareness. Take good care of yourself, take good care of those you love.